Hi everyone, a blessed day to all. Praying that all of you are safe and doing well together with your families and loved ones. I'm hoping that you were able to cope with your online learning, particularly during your midterm examination. If you were not able to have a good grade during your midterms, so this is your chance, your final term. This is your chance to do your best and to give your best. Alright, so this week we will talk about the physical examination of the ears, the nose, and the mouth. Before proceeding with our topic this week, let me present to you first these disclaimer slides. Okay. So, let's start with the examination of the ears, the nose, the mouth, and the throat. These are the learning objectives of this presentation. At the end of this presentation, the student will be able to identify the structures of the ear, the nose, the mouth, and the throat, and able to obtain accurate history of the ear, the nose, the mouth, and the throat. Describe the physical examination technique to evaluate the ear, the nose, the mouth, and the throat. And finally, we're able to document findings from the health history and the physical examination of the said system. Alright, so let us have a review of your anatomy and physiology of the ear muna tayo. Okay, so you know that your ear is your sensory organ used for hearing. Okay, and then the nose is your sensory organ of smell. And your mouth and throat is your sensory organ of taste. And this is the very first part of your digestive system. Okay, so let us talk first your ears. Okay, so your ears is the sensory organ used for hearing. Okay, so it has a critical function. It has two critical functions. The first one is again for hearing, and the other one is for balance. Okay, that's why if there is a problem in your ear, like for example, you are swimming or diving, okay, then a water gets into your ear, but there is a blockage and you feel like you lost your balance, okay, and your role as a nurse is to detect if there is changes in the ear, in the external and the internal ear, and you have to work with the healthcare team that is to prevent further infection and of course to prevent loss of hearing and balance. Yan. To continue with the review of your anatomy and physiology, okay, so your ear or our ear is divided into three parts. You have the outer ear or what we call your external ear, and you have your middle ear, and then your inner ear, okay, or the internal or your labyrinth. Yan. So, your outer ear is composed of the pinna and the external ear canal, or what we call the external ear meatus or external acoustic meatus. Okay, so your pinna consists of cartilages, okay, and it is covered with skin. Yeah, and it has a firm elastic consistency. Okay, while your external ear canal or your external ear the outer two-thirds of this is composed of cartilage, while and again, this is a hairy area and it contains glands that produce cerumen or your earwax. Whereas the inner third, okay, the inner third of the ear canal is surrounded by bone. Okay, so its prominent curve outer the ridge is the helix, and parallel or anterior to the helix is your antihelix. So your pinna is responsible of gathering the sound waves and funnel down to the ear canal, okay, to assist localization of sounds. Yeah. So behind this one, behind your ear, okay, and below the ear canal is the mastoid part of the temporal bone. So this is another image of our ear. Okay, so the orange in color is the outer ear or the external ear, and then the pink color is the middle ear, and the blue color is the inner ear. Okay, let's talk about the middle ear or your tympanic cavity. So your middle ear lies behind the temporal bone and extends from the tympanic membrane to the lateral wall of the inner ear. Okay, so your middle ear is an air-filled cavity that transmits sound by way of the three tiny bones or the ossicles. So we have the malleus or what we call the hammer, the incus or the anvil, and the stapes or the stirrups. Okay, so the sound waves caused by the eardrum to vibrate, which then sets the three tiny bones in the middle ear into motion. The motion of the three tiny bones causes the fluid in the inner ear or the cochlea to move. Okay, the movement of the fluid in the inner ear causes the hair cells in the cochlea to bend. Okay, so again, the ossicles transform sound vibrations into the mechanical waves for the inner ear. Ayan. Now let's talk about the inner ear. So the inner ear includes the cochlea, the semilunar canals, okay, um, and the distal end of the auditory nerve, which is also known as vestibulocochlear nerve or your cranial nerve number 8. Okay. The function of your inner ear is to conduct the sound to the central nervous system and to assist with balance. Now let's proceed to the internal ear. So this picture or this image shows the three main parts of the inner ear. So we have here the cochlea. The cochlea is the auditory area of the inner ear that changes the sound waves into nerve signals. Okay, the semicircular canals okay, here or the semicircular ducts, which has also anterior part, lateral part, and posterior part. Okay, the semicircular canals sense balance and posture to assist in equilibrium. Okay. And the third part or the third main part is the vestibulocochlear nerve or the vestibule or your cranial nerve number 8 at the distal end of the auditory nerve. So this is the area of the inner ear cavity that lies between the cochlea and the semicircular canal. So this vestibulocochlear nerve also assists in equilibrium. Again, your inner ear has two main functions. That yes, it helps you to hear and to keep your balance. So how does sound produce? Again, the movements of the stapes, which is your tiny bone located in the middle ear, vibrate the perilimb in the labyrinth of the semicircular canals and the hair cells and indolent in the ducts of the cochlea, thus producing electrical nerve impulses transmitted by the auditory nerve to the brain. Okay. So the perilymph is the fluid contained within the bony labyrinth. Okay. So the vibrations transmitted from the middle ear that cause the tiny waves to form in the inner fluid, which makes the cilia vibrate. Okay, inulit lang natin, no? And the hair cells then convert these vibrations into nerve impulse or signals which are sent via the auditory nerve to the brain, where they are interpreted as a sound. So that is how sound produced. So again, the hearing pathways have several steps that have to happen from the outer ear to the middle ear to the inner ear for a person to hear a sound, and it was mentioned or discussed in the previous slides. However, this image just shows the equipments used in checking the ear. This is an example of your otoscope, and this one is the tuning fork, which is used to check if there is bone conduction or sensorineural hearing loss. So these are the two types of hearing loss. When we say bone conduction hearing loss, it occurs when the sound conduction is impeded, okay, through the external ear. Yan. So the middle ear or both. Okay, so hanggang middle ear. Kapag may problem dyan. Usually because of blockage. For example, merong earwax, cerumen na naka-block dyan. Okay, that cause the conductive hearing loss. Okay, and the other one is the sensory neural hearing loss. It occurs when there is a problem in the cochlea or the neural pathway to the auditory cortex. Okay, moving on to the health history of the ear. Okay, as a nurse, you have to take note of the common or concerning symptoms such as hearing loss, otalgia or ear ache, otorrhea or discharge, tinnitus, and vertigo. So when we say tinnitus, this is a feeling or ringing of the ear or other noises in one or both of the ear. And the noise that the patient hears isn't caused by an external sound. Okay, and other people usually cannot hear it. Okay, and vertigo is a sensation of whirling and loss of balance. Okay, for the ear history, you can utilize your old card. Okay, for checking the hearing loss, for example, for the location or for the onset, you can ask your client, when did you first notice the changes in your hearing? For the location, does it involve your left or your right ear? Okay, and then, or both ear. Okay, for the characteristics or for the duration, how long does it last? Okay, and for the characteristics, you can ask questions such as, how did you clean your ear? Okay, are you using a cotton buds in cleaning your ear? Or is there any insects that crawl inside your ear? And for the associated manifestations, you can ask the client if it is accompanied by nausea or dizziness. Okay, for the relieving factors, you can ask the client, does anything make it better? Or for the treatment, have you seen anyone for this problem? Okay, you can also check for the ear aches, for the frequency. Okay, check for characteristics if it is sharp, dull. So same, you can also use your old card. Okay, for the discharge, okay, the ear wax. Okay, is there presence of pus or smell? Yan. Okay, so check also if there is tinnitus. Okay, you can ask the client using old card again. So you ask the client which ear, the frequency, and the other symptoms. For vertigo, you can clarify the patient's definition or understanding what is vertigo for him or for her. Okay, so the frequency, the other symptoms, that does it affect or that is have effect on her daily life. Yan. So moving on to the past history. Okay, you can also check if the client has experienced hearing loss before, or removal of cerumen, or does the patient experience swimmer's ear, yan, surgery, trauma of the ear, infection like otitis media, noise exposure, and history of disease. For the family history, you can use your genogram and assess for hearing loss, allergies, smoking, or exposure to cigarette smoke. Okay, for the lifestyle habits, you can check for the occupation of the client, the hobbies and activities. Baka naman expose si client to noise at work. Okay, hobbies ni client is swimming. Okay, use of listening devices, lalo na yung mga kabataan ngayon using earpods or headsets, okay? Use of loud tools, use of earplugs or ear protection, especially during swimming. Baka mahilig siyang mag-swim that did not use any ear protection, or nag-work siya sa isang noisy place, no? Lalo na yung sobrang ingay, no? May mga machines, yan. Use of hearing aids and medication and or drug use that interfere with hearing or cause dizziness. Yan. Moving on to our physical examination after you have your health history. So make sure you gather the following equipment and these are ready for use, okay, and functioning, of course. You should have your tuning fork, your otoscope, make sure that the battery is functioning, speculum or ear speculum, the tongue blade, the gloves, and the pen light. For the pinna or auricle, you have to inspect tissues for deformities, lumps, or skin lesions. Check also for pain or discharge or inflammation. So movement painful in otitis externa. So tenderness behind ear may be present with otitis media. Okay. So this is how you will check the ear canal and the drum. Okay, for patient older than 12 months, you can pull the outer ear gently up and back. Okay, but if they are younger than 12 months, you can pull the outer ear gently straight back. Okay, this will strengthen the ear canal and make it easier to see the structure inside the ear. Okay, and then you can hold the otoscope at the handle with your pinky finger. So these are the abnormal findings of the ear or lumps on or near the ear. So we have here the keloid, okay, the chondrodermatitis nodularis helicis. Okay, this is an inflammatory skin condition that affects the ear. Okay, this is a painful bump that developed in the helix of the ear. So these are another abnormal findings or lumps on or near the ear. We have the tophi. So the tophi or tophaceous gout occurs when the uric acid crystals form masses or white growths that develop usually around the joints or tissues, okay, that the gout has affected. So this is tophi, a sign of gout arthritis. Okay, so this another picture is the basal, an example of your basal cell carcinoma. Okay, so it is a type of skin cancer that most often develop on the areas of skin that is exposed to the sun. such as the face or your ears, diba? Ito behind your ear kasi usually ito yung exposed sa sun. Okay, this is another example or another findings. Cutaneous cyst. Okay, these are common and slow-growing lumps. Epidermal inclusion cysts are the most common cutaneous cysts. This can be flat or raised. And rheumatoid nodules. These are usually firm lumps that develop under the skin. These are the clinical manifestations that is unique to rheumatoid arthritis and usually again occur in the near affected joints. So this is just another example or image of how to properly inspect the ear canal and drum using the otoscope. So this first image of the right eardrum and its parts, and then this is another image of abnormality. Okay, so acute otitis externa, which is a common condition involving inflammation of the ear canal. So the acute form is caused primarily by bacterial infections with Pseudomonas aeruginosa and Staphylococcus aureus, which is the most common pathogens. Okay, so this is another image of normal right eardrum and the perforated eardrum. Okay, so the normal right eardrum or the tympanic membrane, so usually is pinkish gray in color. Okay, while the perforated eardrum, okay, there is a rupture, okay, a ruptured eardrum or tympanic membrane. Okay, there is a hole or tear in the thin tissue that separates the ear canal from the middle ear. Okay, so this ruptured eardrum can result in hearing loss. It can also make the middle ear vulnerable for infections. Okay, but according to some study, this ruptured eardrum can heal within a few weeks without a treatment. However, sometimes it requires a patch or surgical repair to heal. Okay. So, view of the eardrum through the otoscope. No, this is the normal eardrum and the perforated eardrum. This is just another image. Okay, so another abnormal findings, we have here an image of tympanosclerosis, which is a scarring process of the middle ear that involves deposition of hyaline and calcium phosphate crystals in the eardrum and the middle ear. So nakikita natin tong whitish yellowish. It can lead to conductive hearing loss in many cases. It is usually caused by chronic inflammation of the middle ear. Okay, and another abnormality is the serous effusion. These are usually caused by viral upper respiratory infection or otitis media with serous effusion, or can also be caused by a sudden changes in atmospheric pressure as from flying or diving, wherein the eustachian tube cannot equalize the air pressure in the middle ear. So this happens. So for the eardrum, another findings, we have here acute otitis media with purulent effusion. Yan. So it is caused by bacterial infection from Staphylococcus pneumoniae or H. influenza. It is much more common in children than in adults. Usually, the symptoms involve earache, fever, and hearing loss. So, another is the bullous meningitis. It is a viral infection characterized by painful hemorrhagic. So may kita tayong blood, no? Vesicles that appear in the tympanic membranes, the ear canal, or both symptoms includes. So, conductive hearing loss and sensory neural hearing loss. Again, conductive hearing loss can occur when the sound conduction is impeded through the external canal. Yan. So, nakita nyo merong green dyan, no? The external ear canal and the middle ear, or both. Okay, so this is conductive hearing loss if the affected area is the external ear canal and the middle ear. On the other hand, if the affected is, or if the hearing loss occurs when there is a problem within the cochlea or the neural pathway to the auditory cortex, so this is what we call sensory neural. So meron ding tinatawag na mixed hearing loss, which is a concomitant conductive and sensory neural loss. So to test for hearing loss, meron tayong different test. No? You can use whispered voice test, wherein you have to stand at the back of your client and then you can whisper a number or a word approximately at least 60 cm from the patient's ear and ask the patient to repeat it. For example, can you repeat after me 1, 2, or that should be 1, 5, 10, etc. And you let the patient repeat. Okay, it should be non-consecutive numbers kasi kapag consecutive number yan, mahuhulaan niya yung numbers na sinasabi mo. So, another test to check for hearing loss, we have the Rinne's test and the Weber's test. So, this is how you will position your tuning fork if you are using the Rinne's test, and this is where you will place your tuning fork if you are doing Weber's test. Okay, those are the normal findings, and those are the findings for conductive hearing loss and the sensory neural hearing loss. Okay, so if you are using Rinne's test, the normal findings is air conduction is greater than bone conduction. Okay, while the Weber's test, the person or the client can hear the sound in the midline. Okay, if there is conductive hearing loss, the Rinne's test result is the bone conduction is greater than the air conduction. And using the Weber's test, the sound is heard in the bad ear. Okay. On the other hand, for sensory neural hearing loss, using the Rinne's test, the air conduction is greater than bone conduction. Okay. While the findings on the Weber's test, the sound is heard in the good ear. So there is a sensory neural hearing loss. Okay, so with that, let us now move on to the physical examination of the nose. Your nose is used to sense smell. Okay, so moving on to the anatomy and physiology of the nose. Okay, so this image is the outer structure of the nose, wherein you have the bridge, the tip, the anterior nares, the vestibule, and the ala nasi. So our nose has four main functions. The first one is inspiration and expiration. The second one is filtration, warmth, and moisturization of the air exchange. Second one is sensation of smell and resonance of speech. Yan. So approximately the upper third of the nose is supported by the bone and the lower 2/3 by cartilages. So the air enters into the nasal cavity through the anterior nares, okay, on either side, okay, and it passes into the wider area known as the vestibule here, and on through the narrow nasal passage to the nasopharynx. So this is the image of the medial wall of the left nasal cavity, and these are the parts, no? The medial wall of each nasal cavity is formed by the nasal septum, which, like the external nose, it is supported by both bone and cartilage. So it is covered by mucous membrane, and it is supplied with blood. So the vestibule, unlike the rest of the nasal cavity, is lined with the hair-bearing skin, not mucosa. Okay. So this image is the lateral wall of the nasal cavity. So laterally, the anatomy is more complex. These are the curving bony structures, or the turbines or turbinate. And so we have superior turbinate, middle turbinate, and the inferior turbinate. Okay, this is covered by a highly vascular mucous membrane that protrude into the nasal cavity. Below each of these turbinates is a groove, this one, or a meatus, each named according to the turbinate. So if this is the superior turbinate, this is the superior meatus, the middle meatus, and the inferior meatus. So the nasolacrimal duct drains into the inferior meatus, and most of the paranasal sinuses drains into the middle meatus. So their openings are actually not visible. So this image shows the location of the sinuses, or the paranasal sinuses. So this is the frontal sinus and the maxillary sinus. You have here the ethmoid and the sphenoid. Okay, so moving on to the health history of the nose and the paranasal sinuses. You have to check the following, no, for rhinorrhea, congestion, epistaxis. You can utilize your old card. For example, in the rhinorrhea, you can ask the client, when did you first notice the runny nose? Okay, is it in the left? Okay, or right for the location? Okay, so for the duration, how long does it last, and so on. Okay, you have to check also for the type of discharge, the color. Okay, congestion, you have to check if the patient is using any medications, or there is the presence of infections that might cause the congestion. Okay, for epistaxis, you have to take note of the following that may indicate bleeding disorder, or is there any problem. For example, those patients who are diagnosed with dengue hemorrhagic fever. Yan. Or you can also check if there is a change in smell. Again, you can use your old card. So onset, when did you first notice the changes in your smell? Yan. And location, is it in the left nares or in the right nares? Okay. Now check for the past history. Okay, is there sinus infections that happened in the past, or upper respiratory infections, presence of allergies, trauma, or injury that affect the nose, nasal or sinus surgery, polyps, or is there any dental history that again might lead to the problem of the smell. course, part of your health history of the nose and paranasal sinuses is to check for the family history and lifestyle habits. So under your family history, you can use your genogram again. You can check for the following: allergies, asthma. For the lifestyle and habits, you can check for the air quality, especially check for the environment of the client. Okay, is the client living just inside the room? No natural air, yan. Pets, alcohol, tobacco, and recreational drugs. So, in doing the physical examination of the nose, of course, you will need the following. Okay, pen light, of course, to check the internal structure of the nose. The otoscope, you can use that. Nasal speculum, or the largest speculum available. And of course, gloves. Okay, so by using your otoscope, you can view the internal structure of the nose, particularly the middle turbinate, the inferior turbinate, the nasal passages, and the septum. Okay, so you have to inspect the anterior and the inferior surfaces and test for the nasal obstruction by asking the client to cover one nares, okay, and inhale, okay, and then on the other side. Inspect inside of the nose. You can use your pen light or you can use your otoscope. Observe the nasal mucosa, the septum. The septum should be in the midline. And observe for any abnormalities like is there a problem in the bridge or in the cartilages of the nose. Palpate for the sinuses tenderness. So you have to palpate the frontal, the maxillary, the ethmoid, the sphenoid. Okay. Okay, so this is how you will palpate for the frontal. This is where you have to place your index finger. And this one is for checking the maxillary sinuses for tenderness. So this is the references of this presentation. So this is the end of the first part of this presentation. So please watch the second part. Okay, to end this first part of this presentation, let me read to you the 2 Corinthians chapter 5 verse 7. I have to lead my life in faith without seeing Him. God bless everyone. Thank you. Please watch the second part. God bless.